We got our first guests, Shameet and Phil. They are the co-founders of Vheda Health. Guys, welcome to the studio.
How are you? Thank you.
Hey, Scott.
Nice to meet you guys. By the way, my name is Scott Jung. I am the senior editor at Medgadget. We are a medical and health technology blog and journal. Come check us out, medgadget.com. I'm at Scott Jung. Let's get to you guys. So tell us a little bit about Vheda Health.
Sure. So Vheda Health is a cost containment and member compliance company. And our value proposition is very simple, which is we save Medicaid, Medicare health plans $17,000 per member per year by automating care plan compliance. And when you take a look at what our moonshot is, our moonshot for this population is to ensure that no individual has to set foot inside a hospital for a preventable event.
Nice. What else you got to add?
Yeah, so what we do is encompassed in our tagline. So our tagline is humanizing healthcare through technology. So it's very simple, very clean. We also like to streamline vendor management for our clients, so we're not a point solution. So we hit a lot of those pain points with our product offering.
Very cool. It seems like you guys are doing a great job at that humanizing part. It says that you have 87% member engagement rate. Like, what's the secret of that high engagement rate?
So a lot of that is encompassed in what Phil said. It's around keeping the member experience simple. The population that we're targeting is our underserved population, and I think they've been left behind for no apparent reason, no fault of anybody's. However, because they've been left behind, they don't have access to care. And so what Phil and I thought of while we were forming Vheda Health is how do we bring access to care in a very simple and cost-effective manner. And so one of the things that we do is to provide our technology and our solutions in a very simple, easy-to-use format.
Yeah, one of our core values is simplicity. So in order to get the under-resourced populations to really be able to engage with what we're doing, it's making it as simple as possible for them to access the tools, to gain the knowledge, and give them the support that will allow them to live 20 years longer.
Interesting. That brings up kind of a question like, can you share some of your partners, some of your member partners that have helped you guys along the road? And then also, how do you publicize your service?
Sure. So we do a direct sale to the health insurance plan. So our partners are some of the largest Medicaid and Medicare health plans in the country. So if you take a look at the top 5 Medicaid health plans in the country, we're in 3 of the top 5, and that's something to be very, very proud of. We have access to millions of lives, and this is a population that needs that hand-holding or that human touch, if you will. So that's where we're focused.
Yeah, a great milestone we had in 2019 was expanding a partnership that we have. We inked a deal that allows us to affect change on 5 million lives. So we're really proud of that.
Wow, cool. Well, that's great. That sounds like you guys are doing great work. And do you have any other highlights that you want to mention in the past year?
Sure. So what we've seen across our entire book of business, which includes Medicaid and Medicare, is that through our solution, we've seen members participate in our programs see a net reduction in emergency room utilization and inpatient admissions by an average of 40%. And this is something that you don't see with a Medicaid population. And I think one of the reasons why we're able to achieve this, it all comes back to that tagline, humanizing healthcare through technology. The members that are in our programs, we want to make sure that they're part of a journey that's very easy, that's very focused on them. Very similar to what they've set up here at StartUp Health for us. On average, on a particular month, a member receives roughly 90 touches per member per month from our programs. And so by doing that, it creates a sense of accountability, a sense of warmth, and a sense of willingness to participate. And so if you provide that to a population, these are the results that you can see.
That's really great. It's great to see those high utilization numbers. Wish you guys the best, and thank you for being here today.
Thank you.